Hello everyone, welcome to Raaonline. I'm Dr. Abhinaya. I'm a consultant pediatrician. So in the Nelson series under the chapter discussion of nephrology, the next topic of discussion is on renal biopsy. So as pediatricians, we would have sent patients for renal biopsy in many indications, and as residents you would have accompanied the nephrologist or radiologist on renal biopsy. So we have to know where all renal biopsy is indicated first of all, and how did it evolve. So some history we will talk in this presentation, and how do you take care of a patient who has undergone renal biopsy, and very importantly, what are the complications that can happen after a biopsy and how to identify it promptly. Okay, so it's going to be a very brief presentation and let's get started. So renal biopsy was first introduced as a percutaneous technique in the year 1951 by Drs. Iverson and Dr. Brunn. So several modifications took place, after which in 1954 by Kark and Dr. Muirk. So from the initial days it was done through a Wilm-Silverman needle, and nowadays it is done through automated biopsy guns that you can see here in the image. So usage of these automated biopsy gun has become so popular because it has very minimal side effects, and when especially done under ultrasound guidance. So whatever biopsy sample that we receive, we utilize it for the diagnosis of glomerular disease, tubulointerstitial disease and small blood vessel disease. So there are many indications for renal biopsy. We have talked about glomerular diseases, we have talked about tubulointerstitial diseases, etc., isn't it? So we will see if you get a case of acute nephritic syndrome, when it is indicated. In a case of nephrotic syndrome, when biopsy is indicated. Of course, we have discussed this under separate per se under these chapters, but now we will do it collectively also, right? So in a child with acute nephritic syndrome, when all it is indicated. So we know that a child with acute glomerulonephritis, a PAG and etc., the hematuria usually it subsides by 4 to 6 weeks. In case it is persisting beyond 4 to 6 weeks, renal biopsy is indicated. And one more is about hypertension. So we know hypertension can persist and it responds beautifully to antihypertensive medications. In case it does not subside, there is a persistent hypertension beyond 6 weeks, do a renal biopsy. If it is a nephrotic kind of a picture, we know nephritic syndromes, it is 1+ proteinuria or it is a very trace proteinuria. But if there is a persistent nephrotic range proteinuria in a child with post-infectious glomerulonephritis or acute glomerulonephritis for more than 2 weeks, and there is a renal failure, definitely renal biopsy is indicated. And complement levels, if it is persistent beyond 8 weeks or at the onset, if the complement level is normal, then you cannot call it as an acute glomerulonephritis. So in that instance also we will do a renal biopsy. And when there is a systemic feature, so it can be lupus or it can be some other systemic involvement is there, do a renal biopsy. Okay. So the cardinal features you know about acute infectious or post-infectious glomerulonephritis, the hypertension, proteinuria, the hypocomplementemia. So depending on these, and if there is a progressive renal failure in an acute nephritic syndrome, you have to definitely do a renal biopsy. Coming to nephrotic syndrome, one of the very common illnesses we see as pediatricians. So of course, we will do other investigations, we do the renal function test, we do serum albumin levels, urine routine, etc. But when should you refer the patient to a nephrologist for renal biopsy is all these. So starting from the age. So typical age, if it is not the typical age, if the onset is very early, that is less than 1 year, or if it is more than 12 years, it is not the typical age, then you do a biopsy. If there is a persistent hematuria or a persistent hypocomplementemia in nephrotic syndrome, we do. Sustained hypertension is not known in nephrotic syndrome at all. So when there is a sustained hypertension, when there is a persistent renal failure condition, and if there are conditions like steroid resistant nephrotic syndrome, a steroid dependent nephrotic syndrome, and when you want to start on calcineurin inhibitors before cytotoxic therapy, definitely renal biopsy is indicated, and you know the reason why. Yes, we have discussed about this in detail under our nephrotic syndrome. Okay. So nephrotic syndrome child, if there is an atypical age, the presentation is atypical, there is a sustained hypertension, the patient is going for renal failure, which is not attributable to hypovolemia. If it is a steroid resistant state or a steroid dependent state, if you want to start a cytotoxic therapy, you do a renal biopsy.